Underway.
Okay, fabulous. Welcome everybody. I can't see how many, so we've got 17 on board right now, but we might make a start because we've only got a limited time and I'm sure everybody is quite busy this time of the year. So before we begin though, I'd like to acknowledge the traditional custodians of the stolen lands on which we all live and work. And I'm on the land of the Wurundjeri here in Melbourne, in Victoria. And I'd like to also acknowledge that the greatest burden of disease is experienced by our First Nations communities. And then I guess the other groups that follow them include people from multicultural backgrounds. And today we're focusing on international students, sexual health during COVID-19. So one of the other things I'd like to acknowledge when we're starting this is also to think about how important this issue is right now, given the HIV data coming out, that this group is particularly vulnerable and susceptible to HIV exposure for a number of reasons. And some of those reasons will be touched on today as well. So, which will be really, really interesting. The other thing, and also it's World AIDS Day next week. So keeping that in mind for the groups that we work with, and what's the context for their exposure and transmission rates and new notifications as well. I'd also like to say, because I'm in Victoria where we were particularly hit hard by COVID, but now it's really exciting because we don't have to wear a mask outside, and restrictions are lifting. So first time last weekend, people out at restaurants and things like that. So it was amazing. And although some people are quite rude, and I think that's a lot of the things around isolation that we have to all get used to talking to each other as human beings again and interacting socially. So through that period though, the state government of Victoria engaged in a study called the Optimise study. It's still carrying on as we speak now. And the study is looking at how people isolate and quarantine and their understanding of that. And so I led the multicultural component of that. And we interviewed 50 international students particularly. And no surprises here, what we found. So I'll just sort of summarise what we found. Of course, with the first wave in Melbourne, racism was at its highest. So lots of international students were actually being attacked physically, verbally, and so on. So that, you know, causes a great deal of, I guess my involvement with Optimise would like to see, should another thing like this happen, that it also automatically triggers an anti-racism campaign, because once it was international students, then it was Arabic-speaking communities, then it was the South Sudanese, then it was back to Hazara communities. Anyway, so of course, so racism, accommodation, poor accommodation because they've lost all their jobs. People were still being exposed in cash in hand jobs, and they had an inability to self-isolate given that they had no income, they were all living together. So that posed significant issues for them. And also there was a lot of stigmatisation that we noted, which then fed into poor mental health. And also the access to health issue, which we will be discussing today as well, was significant because international students didn't actually know at the start of the pandemic that they were entitled to free testing. So that really goes to show we're starting at the beginning every time. So yes, I think, so the way we will run today is I'm your facilitator. I might introduce myself. So my name is Alison Coelho. I work at the Centre for Culture, Ethnicity and Health in Melbourne, which is part of the North Richmond Community Health Centre. And CEH is a statewide, do a lot of national work as well, predominantly around the health rights of multicultural communities, but we've been working with international students for more than 15 years. So I guess that's sort of my context, and also I'm the chair of the International Student Sexual Health Network. And it would be really good following this meeting, and where we want to go to is aligning some of those advocacy issues so that we can sort of progress these issues further in the new year and actually sort of deal with some of those. So we've got 3 speakers today. We're very lucky to have 3 speakers. We've got Hiro, Judith and Carolyn. So we'll be starting the speakers in a second. Before we do start, I might get everyone to unmute themselves and put the cameras on, because we're going to try and take a photograph for socials. Not sure how that's going to work, but let's give it a go, because it would be lovely to get as many of us, as many of our faces. Is that all you do? Is that as many as we can get for it, you think?
Apologies, I won't be able to get my camera on. So
no, that's okay. That's all right.
Sorry, this is Edwina speaking.
Okay, so we'll just take the photo now. So smile, everybody. Smile. Fabulous. Okay, thank you, and welcome everybody, and thank you for joining us today. Of course, now I'll remind you to turn your cameras off and unmute yourselves. If you want to ask questions, you can add questions into the chat box. There is a facility at the bottom of the screen to raise your hand, and you can also unmute yourself if you need, if you have any questions. So we've got the 3 speakers, then we can have a discussion, a panel discussion at the end. So yes, and because you've got your cameras off and you've got your speakers off, to hydrate and feed yourselves, because it is lunchtime in Melbourne, and I've just scoffed some 2-minute noodles, but because I will be on camera. So please feel free. There's no catering, no drinks in your own kitchens. And so we'll begin with our first speaker. So our first speaker is Hiromi Takahashi. And Hiromi is completing her Masters of Sexology at Curtin University, and is undertaking work in sexual health and blood-borne viruses at the Applied Research and Evaluation as part of the Evaluation Network. She's involved with CoPAHM WA and currently involved in a project to develop a survey for international students across WA. So welcome, Hiromi, and over to you for 10 minutes.
Thank you for introducing me. Okay, let me share my screen. There you go. Can everyone see this? I believe I can.
Yes, we can.
Okay, good. Okay. Thank you. All right, so my name is Hiromi Takahashi, and I will be introducing ongoing project by CoPAHM WA, and it's called International Student Sexual Health Survey. So before that, I would like to make an acknowledgement with the people who works for CoPAHM WA, and I would like to introduce what CoPAHM is. It stands for the Community of Practice for Action on HIV and Mobility, and it's established in 2015 and in a reaction to Roadmap for Action report. And that report explored the link between HIV risk and mobility in Australia and outlined an agenda for research and action for priority So our work pretty much sums up in that area, and is also includes international students and risk to HIV as well. So CoPAHM functions as a virtual network to collaborate between across sector alliance, and our predominant communication tool is email and video conference, and we are always looking for collaboration. So I'm gonna give you some of the contact details in the end. So this project, International Student Sexual Health Survey, we aim to develop this survey and investigate international students' sexual health knowledge, attitude, behavior, and how they are accessing to healthcare service. We like to make this survey periodic so that we can chase and track changes in trends as well. And our entire aim to sort of illustrate a bigger picture of capturing numbers and international students, how they're dealing with sexual health, and inform them to WA Health Department and international education sectors. So motivation was coming from previous research, and in Australian context, international students and sexual health are predominantly focused on East Coast side of Australia. And overall research tells us that sexually transmitted infections and blood-borne virus unplanned pregnancy are increasing among international students. And also less usage of sexual health services. And some reported that international students tended to involved with risky sexual behavior. However, we have a little qualitative research done in WA, but not much, and not to my knowledge and team knowledge, quantitative research, number-based research has been done. And like I said, some of the qualitative research within WA context has been done, and I would like to introduce a bit of my research as my master dissertation. I investigated female international students coming from East and Southeast Asia, and the focus was accessing their accessibility to sexual health services and also sexual health informations. It was qualitative research, and I've done semi-structured in-depth interviews with 14 cisgender identified female international students coming from 9 countries on the slide. The age range was 90 to 35 years old, and all participants has been living in WA and studying in WA for more than a year. And I would like to share some of my findings, and it was a lot. I found a lot of themes. One of the things was perception of sexual health services. So it's also aligned with some of the qualitative research has been done in Australia in East Coast side. My participant also had quite a limited exposure to sexual and reproductive health education back home, and the content was quite biological and physiological focused, such as how to prevent STIs or unplanned pregnancy. So in their mind, emotional and psychological aspect of sexual health was rarely recognized, which brought them to believe that sexual health and reproductive health is only for sexually active people or someone who has physical symptoms. So for them, in order to seek help or information, having these physical symptoms or being sexually active was quite an important cue to seek help. For example, like having a period pain or abnormal discharge, something like physical related cue was necessary for them to seek help. Even though my participant, 14 of them, majority of people were not sexually active yet. So probably that belief was coming from them not being sexually active, but lots of them were dating as well, like romantically relationship involved. And some of them had some difficulty to negotiate with safe sex, negotiate with boundaries within the relationship. Even though they had emotionally related sexual health issues, it wasn't really sufficient for them to go to seek help. Other findings was quite variety of issues. Predominantly, participants found that there was no information source that is international student friendly platforms, both online and face-to-face, and it lets them to seek information passively, and also in order for them to feel safe enough to reach out, affirming of confidentiality and affirming of no impact can be made with their student visa and study record was quite important. Even though orientation week, they had some of the information about sexual health and they were quite positive about it because of the overwhelming information load on that same week or day about academic related or housing related information. They were quite overwhelmed with the information load, so repetitive outreach was quite necessary for them to let them know about sexual health. And also, interestingly, out of 14 participants, 4 of them identified as either queer or bisexual or asexual. And those students, they particularly had another layer additional to international student identity that was being looked at as heterosexual. So with that, another layer added to their identity or another stereotype added to their identity. They had a internalized difficulty reaching out to queer groups. So to sum up from this, so those findings was coming from my research, but some of them were also prevalent in previous research as well. And it tells us that international students has issues and concerns around sexual health. And because those are quite personal experience-based exploration, so it's quite hard to generalize this information. So it also comes back to the reason why I need this survey project to just back up this research has been done and to sort of bring the numbers and put it in the form of research, quantitative research to back this up. So our stage of this project is on the systematic research review and also tool development at the moment. And in terms of tool development, we are looking for some of the collaboration from other organizations as well. And also from next year onwards, we are looking at the ethics approval so that we can eventually publish these research findings, and also finalizing the content and also starting recruitment and report writings. So this was my bit of the presentation, and those were the reference. And if anyone wants to collaborate with this project, or if you have anything to share about your research findings, please contact us to this email address, copam@curtin.edu.au. Thank you for listening.
Ali, you're on mute.
Okay, now I'm not on mute. Okay, so everybody can still hear me. That's great. So thank you very much, Hiro. I'm really looking forward to the panel discussion a bit later. So I just wanted to just remind people to turn off their microphones because there was a little bit of noise during that presentation, and also to write up your questions as we go so that we can have a really good discussion a bit later. So our second speaker is Dr. Judith Dean. Jude is a senior research fellow within the STI, HIV and other BBV research hub at the University of Queensland. She is a registered nurse, a midwife, and is a member of CoPAHM Queensland. So welcome and thank you. So I hand over to you. And Corey, will you keep time?
Hello everyone, can you see my slides? Just checking before I start.
Yes, we can see them. Thank you.
Lovely, great. Thanks, Ali, for the introduction. Before I start, I'd also just like to, if I get my slides working, hang on a sec, acknowledge the traditional owners of the and custodianship of the lands on which we're all meeting today. And for myself here, I join you from the land of the Juggerapul and Turrbal people in Brisbane, Queensland, and I pay my respects to their ancestors and descendants. Always was and always will be. So thank you for inviting me today. I'm here to present on a study that has a bit of a long history. It started way back before 2015, where a few of us who are probably online today, Shihong and Joe and I, were involved in a number of international student projects and things. And then in 2015, we got a small pocket of money to do a workshop where we tried to pull a proposal together with a large number of sort of university and community organisations. We were unfortunately unable to get funding to run the study back in 2015-16, and we sort of let lie for a little while, and then we had a reboot and brought a few of the universities back together and created a consortium of the 5 sort of largest universities in the southeast corner of Queensland. And you can see here our cast of thousands who are involved in the study in Queensland on the slide. And so we still didn't have any funding, but we decided to go for it anyway and just pilot what we had to date to see the methodology and so forth. So like you're all interested, I haven't done any background on literature because I'm sure we're all sort of over that, but really just launched into what we were trying to do for this study. And that was looking at the sexual health and sexual and reproductive health knowledge, attitudes and behaviour of students. And we weren't focusing just on international students because we had a keen interest in looking at the literature around. A lot of it was either just international or college students or specific groups, and no one had really done any work doing comparisons to see if we could find if there were difference across international and domestic students. And then we had a little bit of a thought, well, what about domestic overseas born students? Because from my practice as a clinical sexual health nurse as well as an academic, but they were, I felt, often a group that were missed and not sort of included in some of the programs and things or considered. So we were looking at tertiary students 18 years and over across our 5 key partner members of the consortium. And we did a cross-sectional survey that was online using REDCap. You can see here we used a range of, particularly the National Survey for Australian Secondary School Students as a basis to launch off. So again, we had some comparative data to look for any differences or similarities. And you can see there we tried to cover everything but the kitchen sink almost in the topics that we wanted to include. And that was really where we had a lot of struggle trying to get, you know, a reasonable length survey, but try to gather as much information as we could at the time. So because we were just trying to pilot it, we used some...
Sorry, Jude.
Yes.
Your slides have disappeared.
Oh, have they? All right. Oh, that's unusual. Let me see if I can find them. I'll stop sharing. Now you can't see anything now?
No.
Huh. This is interesting. Okay. All right, let me escape.
There we go. They're back.
Oh, they're back?
Yes.
All right. So now I can't see them, but that's all good.
They're just in... nope, we've lost them now.
Oh, hang on. What can you see now?
We've got a Word document now.
Oh,
Yeah,
okay.
or
Hang on a minute.
specific research questions and outcomes listed.
There you
Because,
go.
yes, and I'm fine if the slides don't work, just to have you talk, because
So how's that? What can you see now?
now we can see
Yes,
slides.
it's all good.
And what slide are you on?
The first.
All right, let's go. There we go. How's that?
Right.
Perfect. All right. So technical. Who knows what happened there? So I'll go there. There you go. There's all the topics that we were covering in the survey. So because it was a pilot, we looked at the actual numbers of students across our 5 major universities at the time, and we were hoping to get it around the 1,400 sample size just as the pilot for the methodology. We used a range of convenient snowball techniques with active recruitment across the different universities, including social media posts, and you can see some of the photos and tools we developed there to use. But 3 of the universities actually got permission to circulate an email to all students across the campuses, which, when you can see here, rather than getting our target, we actually got 4,291 completed surveys. So we far outdone our sample, and you can see the top 3 universities in the graph are actually the ones that were allowed to email all of their students. So it proved that was quite an effective methodology of recruitment, as opposed to just doing social media or even some peer recruitment at some particular events at the other universities. We also managed to get quite a good cross-sectional. I apologise, I haven't got this split into domestic, Australian and overseas born in time for the study, for this presentation. But we were a little bit down on representation of our non-binary cohort. We had mainly under 30-year-olds. We had about 2.5% Indigenous students across a different range of international students, and you can see even in the international students, around a majority of them were actually from non-English speaking background cohorts as well. Majority were single, and interestingly enough, across the different groups, most of them had no religious affiliation. So you can also see we had quite a good representation of same-sex attracted students as well. So to date, we've had 4 wonderful students working on the project, and you can see, looking at the topics we've had there covered. We've also got a number of papers undergo, and we're particularly at UQ because we got quite a good number of students, over 2,000 at the University of Queensland, who completed. We're working with Pamela Doherty, who's running a culturally and linguistically diverse student wellbeing project, and so we're going to look at the data specifically so we can inform, real life current data to inform that project, which is really, really exciting, and student services are actually quite excited by that. So we haven't got much of the data ready at this point, but I'm just going to give you a little smattering of both Teal's and Arabella's work, 2 of my students that have recently submitted their dissertations and honours thesis. We're awaiting results, so we can't be too giving with the results at this point for them. So Teal's work, who was doing a Masters of Epidemiology dissertation, looked at the impact of sexual health knowledge on STI testing, and I think Teal may be online today, so jump in, Teal, if I say anything wrong. But we're mainly looking at differences in STI testing, influences of knowledge and behaviour on testing, and then the relationship between international students. So you can see here, testing wise, in the first graph, domestic students had a higher rate of testing, and that pattern really followed with STI knowledge and sexual health risk behaviour scores, the same trend with those 3 groups. We also looked at the, in relation to the odds of STI testing, and there were some influence around, people who identified as gay versus straight, female versus male, and so forth. So there were some factors that we found did influence testing. Some of the key messages from Teal's work that we hope to get published in the coming future is around STI knowledge was positively associated with STI testing. International and domestic overseas born students did have lower knowledge, as those graphs showed, and lower STI testing rates compared to their domestic Australian born cohorts. And yes, universities are ideally placed for this, sexual health and reproductive health education, but we need to really tailor it to diversity of our students, and considering that it's just often not international and domestic, and there's this group of in-between students that, of course, we need to consider. Arabella's work was one of my honours students who's recently just completed, and she looked at sexual and reproductive health service access. So Arabella's work was mainly a content analysis of a couple of the open-ended questions that we placed in there. So we're still working on the actual quantitative data to support this piece of work, looking at the actual service access, but overall around half of the students had never spoken to a health professional around their sexual and reproductive health issues, and there again were differences across the cohorts, more females versus male students, and again, of course, domestic Australian born students down the same trend as what was found in the other study as well, with only around 28% of international students reporting that they had ever spoken to a health professional. Arabella's content analysis looked at around 900 students responded to a question saying why that they had attended, and you can see there the main reasons that were represented in the content analysis. So possibly nothing overly surprising for people there. We also looked at barriers and facilitators across another open-ended question, and the most frequently reported barriers for accessing services were embarrassment, feeling judged, not knowing where to go, the gender of the health professional. The interesting one was opening hours, meaning that I had to take time off study or school, again reflecting that our health system structures are not ideal, could not afford to visit a health service, and worry about confidentiality. So for international students, cost, language and cultural reasons again were some of the more frequently reported barriers. Again, we do have a quantitative question that we haven't actually got the data ready to report on yet. So hopefully the content analysis will give us that enrichment of data, more rich understanding as we progress with that next phase of analysis as well. And again, within this content analysis, it did appear that domestic overseas students' needs were overlooked within that cohort as well. So our next steps, we'd love to do a larger Australian study. And we'd love to have some funding so that we could actually progress this study further. So I'd also just like to finish off by acknowledging the students who participated in the study and all the wonderful work, and my consortium partners in the research. Without them, we couldn't have achieved this.
Fabulous. Thank you so much. That was great and really interesting, all the different components that you managed to capture there. So thank you, and thank you to all your students as well for all their input. We're now joined by Carolyn Slattery, who is our last speaker before the panel discussion. And Carolyn is a Sexual Health Senior Program Manager with the SDI Programs Unit at New South Wales Ministry for Health. And Carolyn runs and is supporting the international student, well, driving it, the International Student Information Hub and a whole range of things, and we collaborate with, although I can't make many meetings at the moment, lots of program and projects together. So welcome, Carolyn, and thank you.
Thank you so much. Before I start, I'd also like to acknowledge the traditional owners of the lands that we're all meeting on today, and pay my respect to elders past and present, and also acknowledge the land that I'm sitting on is the Kamilaroi people. So thank you. I'm going to try and share and see how we go. So you can see it?
Yes, all
Yes,
good.
we can.
Oh, wonderful. Okay, so today I'll be taking you on a journey today. I like to give my presentations as in a storytelling form. So we'll be going on a journey, and the journey is working towards improving the sexual health outcomes of international students that reside in New South Wales. Whoop. Okay, so we're going to start the journey. Back in late 2018, as a response to the increased HIV notifications of MSM born overseas, a really forward-thinking person called Carolyn Murray actually thought we need to actually get people right across New South Wales that have an interest around sexual health of international students to pull us all together to actually start addressing the issue and looking at strategies and initiatives that could improve the sexual health outcomes of international students across New South Wales. So I think I really talked about the next point. So it's really the purpose of the group was to inform, support and develop, scale up and implementation of initiatives and programs to improve the sexual health outcomes of international students in New South Wales. So the group of us we meet quarterly. It used to be face-to-face, but now it's moved to online. We have a membership of over 60 people. We used to be called a working group, but it got too large, so we moved to a consortium. And Alison is one of those people outside of New South Wales on that, but we very much value your input into the group. So how do you get 60 people to work together? We all have different thoughts and different priorities, and we come from a various range of backgrounds and settings, from universities, all overseas health covers, family planning, ACON, multicultural, HIV, Ministry of Health, it goes on and on. So we actually decided that the best to do is actually undertake a lit review. Oh, I've jumped too far. There we go, sorry. Undertake a literature review, looking at what are the barriers for international students to access sexual health services and information. From there, we developed 2 workshops to actually prioritise those barriers. And from those workshops, we identified that health literacy was something that was the first barrier that we're going to address for a number of reasons. It was probably one of the easiest ones, and it was a very collaborative, it would be a collaborative effort. And it actually, it's a priority for all those organisations that were in the room. So that's the issue that we decided to work along. So moving along the journey, in late 2019, we obtained a Study in New South Wales partnership grant to develop a sexual and reproductive website stroke hub to contribute to addressing health literacy of international students. So we undertook consultation, because this part of the grant was that it was developed in co-designed with international students. We undertook consultation with international students. It was supposed to be face-to-face, but COVID got in the way of everything. So it was done online. And so the consultation, we were trying to actually gain an understanding of what international students need, what content they want, and also the look and the tone of the hub. 191 international students participated in the hub, in the consultation, sorry. So here's just a really quick snapshot, and I'll talk a little bit more about this after this snapshot. One interesting thing is that doing it online, we actually got a greater participation rate right across the state of New South Wales. Usually we have more people participate that are in Metro, but this was quite different, and we had 45%, sorry about how small it is, 45% of participants came from rural communities. So that would be right up top of Lismore, out at Wagga, Armidale, so forth. Other breakdown information here is 77% were heterosexual, 22% LGBTI, and 1% something else. When over on the, well, I might jump back over to the left-hand side. Attitudes and values. We asked them what did sexual health mean to them, and 56% said avoiding an STI. In relation to sexual reproductive health, what did that mean to them? And having access to contraception, 58% thought that's what it meant. In regard to respect and communication are important for, is good for a sexual health relationship. That 75% thought respect and communication was important. when we ask them about what do they want the website or the hub to look like, what does it, what are some of the characteristics is needed? And they actually wanted something that was trustworthy and respectful and professional, visually appealing, representative of diversity, clear and easy to understand, scientific and trustworthy, friendly and reliable, bright and colourful, and minimal text with lots of information. When we ask questions around what do they need to know, what knowledge do they feel like they needed more knowledge about? Number one was STIs. Number two, cost of overseas health cover. Number three, Australian healthcare system, and it goes on. They were the levels of importance. It's a really, really quick snapshot. However, the good news is coming up. Where Limin's online today, Limin Mayo from UNSW in Sydney has been working on this project with us, and we have the delight in actually having a student undertake a further analysis, both qualitative and quantitative analysis of the data. So a consultation summary report has been developed, and we're just going through the throes of developing some infographics to accompany that. So that report will be available, I believe, in December. The other thing that we will do out of this data is there will be a series of webinars for different audiences. There is some really valuable information for different audiences that has come out of this data. For example, overseas health cover, we could do a whole webinar just presenting the data back about what international students feel about overseas health cover. The other audience could be universities, but this is in the planning phase, but there will be a series of webinars that will be conducted. So travelling along the journey still, the hub is being created by an external contractor that has years of experience in developing sexual health websites here in New South Wales that target young people. We've identified all the content and it's going through approval process over the next couple of weeks. This hub, it is a hub. It's there's a number of things that international students want to know. So we've actually posed the hub in a series of questions, and it's broken into categories. For example, sex and sexual health, overseas health cover, Australian health system, privacy and confidentiality. So they can click on those topic areas, and then there will be a series of questions that will be asked there. And if they click on those questions, it will take them to a link of an evidence-based, reliable web page somewhere. For example, the question might be, what is an STI? So if they click on that, that will take them to a web page that answers that question, what is an STI? And in this case, it will take them to the New South Wales Play Safe website page that has the answer to that question. So the other really important thing is that we needed to look at was the design of the hub itself. And so we undertook consultation again with 31 international students in regard to the hub's design and ease of navigation. So that's also fed into the design. So what's coming up? And we come into the end of the first journey. The hub will be launched on the 14th of December. A communication plan is in develop, and that's really a dissemination plan. It's being developed. The promotion will be in 2 stages. It will be phase. First phase will be December when it will be launched, but a really major launch March when universities start back. We'll be monitoring the hub's usage and flow and looking at click-ons and where international students are going to. We have to say that this hub is a work in progress. It will continue to be built on and improved on, and potentially even move to including other areas like mental health for international students. So what's next? Back to the consortium. Because this was the first bit of work the consortium has done, we'll need to next year, in 2021, we'll be looking at identifying future barriers that we can address in collaboration across New South Wales. We'll continue to promote and improve the hub. And another little piece of work that's happening in New South Wales is a peer education toolkit for international students will potentially be rolled out through universities across New South Wales. We hopefully pilot that early next year and then roll that out after the results are in. The last slide, lots of acknowledgements here, it goes on and on, but I think the two people highlighted down the bottom that I would really like to pay very special acknowledgement to is Limmy Mayo and Maddie Stratton. I could never have done this without your guidance, support and friendship. Thank you.
Fabulous. Thank you so much, Caroline. I'm a bit exhausted just hearing all the stuff that you guys are doing. It's fantastic. It's amazing. So we'll move into the discussion panel now. And I just wanted to highlight observationally all of you guys that there are some sort of thematic things that keep coming up that I guess are not surprising for us. And I guess what I've noted mostly is, number one, the access issues that students is perennial. It still continues, access to those sexual health services. Also, the issue around consent, not just consent within a relationship, but also consent around testing and understanding, which is really an issue around health literacy. So assuming that everybody has the same sort of knowledge about sexual health and therefore good sexual health literacy as well is something that we need to work with our clinical services a bit more. And also just coming back to, I guess, the service navigation issue. So it's not just access, but we're also looking at, you know, how do I get there, and if they are accessible, how, you know, who's the right person to speak to and when is another issue as well. So, but fundamentally underlying, and this is what we found in our work over many years and some of the research we've done, is that relationships are key to these young people. They've moved overseas. This is the first time for a lot of them that they're sexually active, and they want to know about respectful, healthy relationships. They want to know about negotiating safety in their relationships as well. So thank you everyone for such thought-provoking, amazing presentations. They were fantastic. And we'll just look at some of the questions. So I'll let people just unmute if you've got a question, and then we'll hand it over to the panel. Is there any questions? Service delivery, but there is also an issue access. I can't see that. Oh, there we go. Transition as migrants to students, okay. And how do we build relationships to improve their access? So I'm going to hand that one over to Jude. Would you mind answering that? And thank you for your question, Tico.
I'll disclose a conflict of interest because Tico and I actually work together. So thank you, Tico, for that question.
Lovely.
And Carolyn may be better placed being a health promotion, probably more health promotion than I am to answer this. But I think it's that a little bit like the project that UQ Health Student Services are looking at developing in trying to look at the best mechanisms to engage the students and early on, and if not pre arrival as well, to start that sort of embedding sort of understanding of the, you know, the health systems in the country where they're going to study, you know, and things like that. So I think it's more than just, you know, the leaflet in the O-week bag. So I think we need to do a lot more work on how we can really engage early, so that like some of our researchers finding they only come in when there's an issue.
Yes.
So a lot of the work that I think all of the speakers have presented and all of yourselves are all engaged with is trying to get that foundational understanding about how we can assist in that transition so it's smoother and not disease-ridden health seeking as opposed to health promotion seeking.
Yes, because that was a focus as well that I think you mentioned. I'm not sure who mentioned that there was a really strong biological focus on sexual health as opposed to the relationship aspect, which is what students wanted. So thank you very much. Now, there was a question regarding the launch of the toolkit, and I'll give this to you, Caroline, regarding how we're going to engage universities. And I'm also thinking about other institutions such as TAFEs, because we know that 40% of international students are also at TAFE. So how are we going to engage them in the launch process and understanding what the toolkit and the hub can bring to them?
Yeah, that's a really good question. That's where we're at. Been really fortunate because of our wide, diverse group of consortium members. There is also, we have contact with all the universities through health promotion offices at all the universities too. Someone's just sat on the phone for days and collated names, and they're now there. And also English Australia and TAFE, TAFE International are on our consortium. So we've actually got most of the places covered. So the consortium members are our mobile tools of getting dissemination information out there. When it came around the toolkit, the peer education toolkit, there's been a tool that's been developed, a part of the Play Safe program in New South Wales, but it's a generic tool, and it's never actually been piloted with international students. So two universities have put their hands up, and they're going to pilot that, and through that piloting, probably amendments will be made. Our talk to universities, even around the consultation, they promoted the consultation in the universities. So I always find getting on the phone and talking to the health promotion officer at the university is the best thing, not sending an email. So you spend days on the phone, but that's okay. They are really desperate to get information. They don't know how to do anything around sexual health. So everyone's really excited that, you know, this hub, it's not an answer to everything, but it's something. And I think once we have a pilot of a tool that it's shown effective and efficient in the university setting with international students, it would just be back on that phone again and sending that out. And there's leaders of the peer support program. It's the way it's structured in New South Wales, but there will be some leaders that will be able to support the rollout of that scale up across the state if it's shown to be effective and efficient.
Fabulous. Thank you so much, Caroline. And I guess that is a really critical issue for us to think about the dissemination. But wherever we go, CoPAHM, New South Wales and Victoria, TEXA and Universities Australia have to be involved. I mean, I think that's a no-brainer there for all of us to look at. Now, there was another interesting question from Joe. Thank you, Joe, for your question regarding the overlap with sexual exploitation, which we know is a huge issue. And I think the pandemic really hit hard for some international students that were funding their education via sex work and have been either driven underground or have been completely unable to sort of sustain themselves. So I might throw that question to Hiro. Did you want to speak to that regarding sexual exploitation?
Hi, thank you. Regarding sexual exploitation, how do you say? So from within my research, the COVID, because WA-based research, COVID-19, when I was doing the interview, it didn't really impact international student life unless they lost their job and their priority to sexual health issue has been sort of coming down because they didn't have incomes and they had different priorities and stuff. I can't really say sexual exploitation bit. However, in general, my participant had difficulty to negotiate condom use, for example, especially with my main participant were heterosexual. So they tended to have male partner, and some of the people who had quite passive attitudes towards negotiation, then they ended up saying yes to unsafe sex. It's just a matter of not having enough language and experience of negotiating in back home as well.
Yeah.
Sorry, I'm not sure if it answers the question, so sorry.
No, that's fine. That's fine. And we do know that both of those are significant issues. Now we're coming to the end of our time, and I'm sorry that just very rushed, very big topics, and I think we'll have to organise more, Corey, with all of us. So thank you very much for joining us. There will be more information coming out regarding some of these key issues. We would like to take these forward, and certainly at the International Student Sexual Health Network, negotiating the deed has been one of those things that we would really like to have a bit more momentum with, and certainly partner with CoPAHM and New South Wales to undertake that process in a much more sort of strategic, aligned way, so that we can actually negotiate some of that stuff around testing and access to those services more broadly. And if you have any feedback, please contact the emails on the screen that Corey's about to put up. And if you'd like to be involved with CoPAHM, or if you'd like to join the International Student Sexual Health Network, please feel free to contact us. Our emails are there, and two of our staff are also online today, Aditi and Kanwal, who do extensive, amazing work with international students across Victoria. So thank you once again, everyone, for joining us, and particularly to the speakers for sharing great knowledge, but also for confirming a lot of the things that we already know. And I guess now from next steps from here is how do we put all this information that we all know, and it's consistently getting bigger and bigger, and we know that STI rates and HIV rates are not changing. The trend is definitely established with this group of people. Where do we go from here, and how do we take that up a little bit more strategically? And I'd also like to acknowledge that Heather O'Donnell from the Victorian Department of Health and Human Services is also present, and I guess involving all our state governments and territory governments in this process to support the advocacy up would be priceless as well moving forward. So thank you, everybody, and enjoy the rest of your afternoon or morning if you're in WA, I think, and take care and be safe.
Thank you.